The Blair House. President Obama walking from the White House across the street to the summit now. Back at Blair House, the healthcare summit expected to begin momentarily. 4 topics today on healthcare costs, insurance reforms, deficit reduction, and expanding coverage.
I know it's not normal. I'm better.
Hey. Hello. Good to see you. What's going on, brother? Good to see you. How's that going? Good. How's it going?
Mr. President, we don't want to lose you over that ladder.
Absolutely.
Hey, Mr. President, good to see you.
Yeah, they threw in the Illinois guy this time.
Hey, Mr. President, would Jocelyn available room here?
You guys are going fine.
Mr. President, Marcia White.
Morning. Good to see you again, Paul Ryan.
All right.
Good to see you. Thank you. That's nice to say so. Appreciate it.
How are you?
We work on DC.
Behind you.
Hey, Vice President Peter.
Good to see you.
Yeah, thank you.
How are you?
Hi, I'm Marcia
I know,
White.
Marcia. How are you?
I'm well.
Hey, yeah, Paul Ryan, nice to see you. I'm doing great. Good to see you.
Morning, John Clyde.
Actually, you did.
Everybody, please have a seat. Come on, man. Good morning, everybody. Welcome. Thank you so much for participating today. I am very grateful to all of you because I know how busy you are. What I want to do is just make a few brief remarks on the front end, and then we're going to allow leadership from both the House and the Senate to make some opening remarks, and then we will dive in. Last year, obviously, was one of the toughest years we've had on record, and all of us, in one way or another, were devoted to focusing on breaking the back of the recession, restoring economic growth, putting people back to work. We've still got a long way to go, and so I know both the House and the Senate are interested in how do we propel economic growth forward, how do we create more jobs. I was very pleased to see a glimpse of bipartisanship in the Senate recently in passing a jobs bill, and I hope that continues, and I know there are going to be some additional pieces of legislation moving forward around, for example, making sure that small businesses can get financing. And those are the kinds of things that I think all parties and both chambers should be able to agree to. So I'm very much looking forward to working with you on all those issues. I have said repeatedly, I said at the State of the Union, I said last night when I was meeting with the Business Roundtable, that in addition to dealing with the immediate challenges we face in the recovery, it's absolutely critical that we also look at some fundamental structural problems in our economy that are hurting families, hurting businesses, and having an impact on the exploding deficits and debts that the federal government, but also state governments, are carrying. And it's for that reason that last year, around this time actually, I hosted in the White House a healthcare summit and indicated to Congress that it was absolutely critical for us to begin now moving on what is one of the biggest drags on our economy and represents one of the biggest hardships that families face. Some of you know that I get 10 letters out of the 40,000 that I receive every day for me to take upstairs to the residents and read every single night. And these are letters from all across the country, constituents from every walk of life. And I can tell you that at least 2, sometimes 5 of the 10 letters relates to the challenges that people are experiencing in healthcare every single day. I'll get letters from parents whose children have pre-existing conditions, and maybe those children were able to get health insurance when they were young, but now they're growing up